Visalia, California is an economically poor community with significant uninsured and migrant worker populations. By listening intently and discovering new ways to meet the complex needs of this unique community, Kaweah Delta Healthcare District has met these challenges through strong community partnerships and comprehensive outreach programs. This healthcare network is investing in children, parents, and the elderly through broad-based community programs that stress health education, stronger families, and increased literacy.
Our community is really challenged demographically. We just have a lot of poverty, a lot of unemployment, and things seem kind of bleak sometimes. So I think what we're talking about when we're saying the impossible, it just doesn't seem like there's enough resources sometimes to meet all of the needs. But the people that we've had here and the community that we've been a part of have really risen to the occasion. They've made things happen.
Staffed by Kaweah Delta doctors and nurses volunteering their time, the Good News Clinic provides free pediatric, general medicine, and women's health care to more than 4,000 people each year.
The Good News Clinic was founded to take care of the very poorest of the poor, people who have absolutely no insurance or any access to medical care. So these are a lot of people who have never ever in their lives seen a doctor. The biggest hurdle is trying to get them into the system somehow or another so that they can get continuing care. We have to be educating. If we're not educating, we should go out of business. We're always going to have the poor, but we really have to educate them and try to change what's happening right now. These people would never be cared for unless they did come in to see us. For us, every day seems to be a new miracle.
Since its inception, the Mobile Dental Clinic program has helped more than 800 children whose parents could not afford the cost of the dental care they needed.
Number one healthcare need, which has nothing to do with a hospital, remember that, was dental care.
No? Okay, you ready?
What happens with the Mobile Dental Clinic is that they do all the care in 1 week, and the child then, from then on, is just doing follow-up care.
I'm kind of happy.
Why?
Because this is the first time I've ever been to the dentist.
Kaweah Delta really stepped forward and did something that no hospital does. They stood up and said, this is a number one health need. It does affect how we do things. It does affect our children in such a way that they can't be successful. We're going to do it. People want their kids to be in the clinic because they know the benefit.
The Lifestyle Center is a medically based health and wellness center offering outpatient physical therapy, cardiac rehabilitation, and exercise and fitness programs on a scholarship basis to patients who cannot afford to pay.
I went to see my doctor and he recommended me over here. And then he wrote a letter to him saying that I need this, because we having bypasses, being a diabetic too, and high blood pressure and all this stuff. It would be good for me. It would help me with my health.
I think the hospital gets its benefit from this by keeping them out of the emergency room. We get the benefit by seeing a smiling person, somebody that's able to interact into the community and say, hey, I feel good. I'm able to do this.
I just feel great now, but I'm going to keep on coming as long as I can.
Strong families are the cornerstones of a healthy community. The Parents Helping Parents program builds the strength of families by providing the tools to help people become more effective parents.
It's about parents, it's about changing lives, and it gives parents the tools that they need to not only change themselves, but to change their families.
I don't want to be the way my mom was to me. I mean, I had a little bit abusive and a little bit of everything, and I don't want the same thing to go on with my kids.
It's parents in the neighborhoods teaching other parents.
We ourselves are actually our own teachers. And the parents that are involved there are actually our teachers also. And it's more of a unity rather than I'm the teacher, you're the student.
What it comes down to is people learn to take responsibility for themselves, for their lives, for their own health, that somebody else isn't responsible. It's a program that comes from the heart.
Teenage pregnancy leads to increased poverty and poor health care. The Youth Connect program addresses this problem by empowering teens to make healthy choices about their lives and their futures.
Here in Tulare County, we have near the top annually one of the highest teen pregnancy rates within the state of California.
I come from we're Mexican background, and these families really don't discuss this like we do at school. It's better for us to know, because again, it's not all the time. Some men are very responsible, but most of the time it's the women that has to stop from going any further, so it's better that we're educated about it.
This program, we're focusing on a segment of the population that unfortunately sometimes is underserved, and that's our adolescents.
Each day, the HEART program gives children in Visalia a positive place to be after school that encourages learning and enriches their lives.
The commitment by the parents is a very big part of this. You know, we have, as I said, migrant farm workers, parents who see education as the only real opportunity to break a cycle, either of poverty or having to work in the fields. When they have an opportunity to come into a program like this, their parents are glad to have them in it.
We're here for the children. We love, we nurture them. We provide a safe environment for them. We care about them and their needs, and we really care about them and their needs. It's personal. It's just not, this is a job. This is a personal thing, you know. It goes deeper than I can ever even say it.
It felt good because I don't have to do my homework and have a hard time getting it done. We do our homework so I won't have to do it like my house, and I used to write sloppy before. Now I write better than I used to write.
It's a long-term investment that the hospital has made, but I think it extends beyond only specific medical kind of care to a more comprehensive understanding of how the community will benefit from this kind of program.
We've looked at the community as an area that we have to be involved in throughout. What their problems are, what their needs are really our needs. We're here for the community. The community's health is something that we have a broad definition of, and our board has said a community is our 5th campus.
Community partnerships are the cornerstones of a healthier America, and they're essential if we're to achieve our vision of each individual reaching their highest potential for health. So, congratulations to the folks at Kaweah Delta Healthcare District for leading the way to a healthier America. We are very proud of you.
The Baxter Allegiance Foundation and the American Hospital Association congratulate the 2000 Foster G. McGaw Prize winner, Kaweah Delta Healthcare District, Visalia, California. We also honor the finalists: Columbus Regional Healthcare System, Columbus, Georgia; Spectrum Health, Grand Rapids, Michigan; Yakima Valley Memorial Hospital, Yakima, Washington;